Welcome to the Tribune's Neighbor to Neighbor podcast, a sponsored conversation with TriState Health and the TriState Health Foundation. I'm Keith Havens, and I'm joined by Dr. Carson Seeber and Ottmar from TriState. Now, today we're exploring an important new chapter for healthcare in the LC Valley, the launch of TriState's Family Residency Program and a community event that's helping make it possible. We'll look at why community support has played such a vital role in TriState's growth and how this initiative is shaping the future of care close to home. So thank you very much for joining us.
Happy to be here. Thanks for having us.
Well, let's start off with our first question here. Can you talk about why community support is so essential for TriState Health and how the foundation helps make it possible?
So for us, TriState isn't supported by a taxpayer base. And so we only generate revenue by the patients that we see and the money we raise from the community to help us keep our doors open and to provide these wonderful programs. So it's vital to us in making sure that we have community support and buy-in to help us continue the services that we provide.
That is great to hear. And I think a lot of people don't realize the funding of TriState Hospital. So I'm glad you talked about that. So why is the Family Residency Program, or what is it, and why is it so important for TriState in our community?
Well, I think it's timing more than anything. We've never had a family medicine residency program or any physician residency program in the Valley. And with TriState's growth, especially in the last 10 years, with bringing in a lot of subspecialties and specialty services, it's a great time to take on basically an endeavor like this that is monumentous, but has a potential to serve the community for years to come.
And you just kind of hinted at it right now, which leads into the next question. Why is it so important for TriState Health to add the program now?
Yeah, so I'd return to the fact that we've had so much growth in the last 10 years. There's a couple statistics that come to mind. One is nationally, in the next 10 years, in rural and underserved areas, we're going to need another 180,000 physicians. And, I guess if we're in a position to help that, then, we should. And if we don't, then who else will? I'd round it down to more locally. Eastern Washington and Idaho have some of the lowest per capita physicians available to our populace. I think the state of Mississippi is the only state in the country that's worse than we are. And so even locally, there's a need to make this happen so we can at least contribute to future growth and the supply of physicians for years to come.
Do we have, and this is just a curveball question, I think, do we have people from here that are in any type of medical school that would be taking a look at coming back? Do we know that information?
Yeah, there's a surprising number of local students that are medical students, either at WSU or even outside of the state. And so, yeah, we call them prodigal sons and daughters. We'd love to bring them back, and a residency program offers that opportunity for them. Whereas normally they'd have to go to another state or another institution to get their residency training.
I think that would be great to be able to work where you're from for a while.
Yeah, I think it's a comfortable, good fit. When somebody returns and they have family or friends in the area, I think they see it as a great place to practice their craft and to raise their family if that's their lot.
Well, how will this program improve access to care for local families?
So I think the biggest thing is in undertaking a family medicine residency program, TriState would be responsible for developing a family medicine residency clinic. And so at our capacity, if we were to have a residency program, once we're full steam ahead, we'd have 9 total residents who would be seeing patients and having panels at this family medicine residency clinic, which would most likely be on our campus. And so you're basically adding a whole new family medicine clinic to your region. And although the residents come and go after their 3 years of training, there's always a new set of residents that are coming in to absorb that panel that's established there. And so to give a couple numbers, like these residents are expected to see anywhere from 1,600 to 2,000 patient encounters, essentially, in the 3 years that they're here. So in any given year, we could see 13,000 patient visits at that clinic. And so certainly that helps address even our need locally in terms of the populace that don't already have a family physician.
And so what kind of doctors are you guys looking to attract to bring into the area?
Well, I think you want a rurally minded physician. You want somebody who wants to be able to know a little bit about everything. In rural areas, you don't necessarily have access to big hospital centers, and so you have to learn to be self-sufficient. On the flip side of that, we have so many specialists locally. There's also a great opportunity to take some of their wisdom and apply it to your family medicine skill set. I've always used the expression that family medicine physicians need to know a little bit about everything and maybe be okay with not knowing a lot about anything, but that little bit about everything is so important.
I've known DeLynn for years, and when we have talked about in the past about TriState Hospital, she has kind of filled me in on the expansion. And here you added the big wing, and that was a few years ago.
Yeah.
And that seems to really have taken off. It is impressive to see TriState take a look at what the needs are of a community, and then they fill it. And that just seems like that has been the model for as long as I can remember. Is that true?
I pretty much think that they do their best. They do a critical needs assessment about every 3 years, and they look at that and they say, okay, what are we lacking and where can we grow? And what does the community need? And so for a while it was behavioral health. That's been a big focus. And so we are addressing that. We have a behavioral health clinic. We also have a doctor who specializes in addictive medicine. And so, those are things that we're really focusing in on. Also, another one, endocrinology. Isn't that a big specialty? And so, not to say that we're getting it, but those are things that we look at and what are those needs and how do we fill it? And OBGYN, that's a prime example of us kind of filling that need. And then we had an opportunity to add orthopedics and also dermatology to our clinic services. So that's been really tremendous for us to be able to offer those types of services. But then, at every turn, when we put in a lot of investment into our infrastructure, as in the new inpatient wing, and everybody having a private room, that healthcare experience is much greater, and provides that basically the environmental healing environment. And so we're very proud of that. And then also we just upgraded all of our imaging, right? We have new MRI, we have 2 CT scanners. We are state of the art. So if you get any imaging, you want to come to TriState and get that.
Does it, when you look at the wing and everything else, everything that you can do, does it kind of surprise you, like, how did we get along without it? You know what I mean by that?
Yeah.
It is so impressive what you guys have done. And with any program, there are startup costs.
Yeah.
So what are you guys looking at startup cost and fundraising goals?
So for us, I feel like the startup costs, we're partnering with WSU and Lewiston College of Medicine in this process. And so they kind of been working with hospitals because we're not the first program that they are working with or have helped start this process. And they kind of average it at about anywhere from $3 to $5 million for startup costs, which, that's creating curriculum, that's hiring people, that's infrastructure, that's, Carson can kind of go through and list all those expenses out. But the fundraising goal for us is we hope to raise maybe around, maybe a little over $3 million, because we hope to keep our starting costs, at the lower end,
Right.
if at all possible. And so that is our goal to help make this happen. And I'm not sure, but it just was recently announced. We just received $1 million from as federal appropriations
Wow.
to help with the startup costs too. So now maybe we're down to 2 million that we need to raise. So that would be great.
That's exciting.
Yeah.
That is great news.
Yeah.
I hadn't heard that yet. on
Yes.
that. So on your end, that's got to be exciting for you too, to see this starting to take off.
Yeah, like Delynn said, the hardest thing to do was imagine, I think, or have an imagination. And when the federal government comes forward and says, here's a little Kickstarter, now we can build on top of that. So like Delynn said, you have your upstart costs, but then, every year you have maintenance costs as well. You don't need a residency program to be profitable, and in most cases they aren't. And in some cases they may not even break even, but whatever deficit that is financially year to year, you want to mitigate that as much as possible. So, and funding can't come from one place. It has to come from a wealth of resources and has to overlap, and you have to have as much of a guarantee as you can. And of course, there's state and federal funding. Philanthropy is so important. So as well. So we really do hope that the community will get behind this and see the value of it for years to come.
This is just another curveball question here. Has this been sitting on the dream board? Because I think every successful business organization has a dream board, because dreaming is free. But what do we want to achieve? When do we think we can achieve this? Has this idea been on the dream board for a while?
Yeah, I mean, I think before COVID there was talk of it, and we knew that we weren't necessarily in a position size-wise or personnel-wise or even financially to make it happen. But that's when we started those conversations, and then our board got together in 2024, and it was a part of one of their major strategic goals going forward. So as you talk about the timeline going forward, that's less certain. We'd like to think that we could have something like this running up and running yesterday, if not next year. But it does take time. And WSU, our sponsoring institution, who are in partnership with us to make this happen, of kind of different times said, just pump the brakes a little bit. We'll make this work. Just give it time. And so over the next few years, I'll commit to that we'll have our first group of incoming residents.
That's great. So how does this line up with TriState Health's mission and to care for the community?
Well, our mission is your health is our first priority. So I really feel like that speaks volumes to making sure that we're providing healthcare providers for residents in our community. I mean, the statistics are of the people, about 19% who come into our ER don't have a primary healthcare provider.
Wow.
And so for us to be able to create those opportunities, and I mean, we're getting anywhere from 200 to 300 requests every month for people wanting to set up with a new provider. So how do you fill that need? That's what we're focusing on. That's what we want to make sure that we can make sure everybody has a healthcare provider, that you're getting that care that you need, and in our community and our local region here. So it's not just in the Lewis-Clark Valley.
This program sounds outstanding. It sounds like you have some fantastic partners that can help guide where you guys want to go. Is that right?
Absolutely. Elson Floyd felt like a natural partnership, the School of Medicine there at WSU. If you look at what they're trying to do on the east side of the state compared to maybe the University of Washington healthcare system on the west side, like University of Washington has massive healthcare infrastructure, and WSU really doesn't. So they rely on, their mark being, cemented across the eastern side of the state through already established healthcare infrastructure. And so they partnered with Pullman Regional Hospital just north of here in the last few years, and have enjoyed success there with their residency program. They've gone inland in the state to Samaritan Hospital, Moses Lake, and are working with them to do some of the same endeavors. And it just felt like a natural fit for us in this southeastern part of the state to join forces with them. So
I
they've
agree
been a
100% with that. Yeah.
great partner.
Delynn, we got a fundraiser program coming up for
Yes.
for someone that wants to donate. Let's talk a little bit about that. When does it start? Is there an end time on this? And how do they donate?
So we are Fund Our Future Mediathon is taking place on this Wednesday, December 10th. And we're really excited about it because we want people to be able to go and just give or challenge your friends, challenge your family to get involved and your coworkers. And so really this mediathon is going to be broadcasted over all the radio stations, TV, social media. And we just want to bring awareness. We want to share with the community what this program is going to be about and how they can get involved. And so they can donate online. They can come and visit us on Wednesday. We actually moved our foundation office. So we have a new location. And we're located at 302 5th Street, Suite 3. It's in the Edward Jones building with our Known Wealth Management between Costco and Walmart. And so we're actually the old Aquavia Spa. And so we're really excited. So we're doing an open house on Wednesday so they can drop in, say hi, donate. And we would love to see you and welcome you and just really share information about our program and just really want to get the community involved. I mean, it's been a very interesting and dynamic holiday season. If I can share just the experience at Festival of Trees that we had. We had a donor that donated and bought a tree for $420,000. We also had a donor that gave us $250,000 towards our Raise the Paddle, which is supporting our surgery and clinic expansion. So there is some really generous people in our community, and we are so excited about everything that people are doing to support TriState and the endeavor that has just grown. It's if I can say it's epic. It's epic.
Yeah.
It's just been so cool.
But you can see it. You can see what's happening. Like I was telling you earlier, the growth, the expansion. It's filling the gaps that you guys have identified that need to have personnel in there to help our community. I think we're all on board on this. This is fantastic. So, is there anything else that you'd like to tell everybody?
Just this. I mean, our community has always come out to support us, like Delyn's saying, and I have no doubt that even in the context of a family medicine residency program, they'll continue to do the same. So we need you. We want you to be a part of it, and at the end of the day, it's for them too. So.
All right. Well, Delynn, thank you very much. Dr. Carson, thank
you
very much. Appreciate you guys being here for Neighbor to Neighbor. So this has been the Tribune's Neighbor to Neighbor podcast, a sponsored conversation in partnership with TriState Health and the TriState Health Foundation. Now, for details about the Family Residency Program or the December 10th fundraising event, Fund Our Future, visit tsh.org/foundation. I'm Keith Havens. Thank you very much for watching.